there is increasing concern and fear of using antibiotics in everywhere, in all types of medicine. So the antibiotic stewardship program was created to check and control the usage of antibiotics. To some extent, it has been shown that when antibiotics are indiscriminately used in young children, it could affect their immune status and can predispose them to larger and worse disease cases over the years. So what can be done? Are there anything for a bladder infection? One of the most common infections. Can something be done which does not involve antibiotics? Well, there are things like mannose. And what mannose does, it's a powder that you take with a glass of water. And mannose coats, as you can see here, it coats the lining of the bladder. So when this E. coli come in, the E. coli gets coated by this mannose and get flushed out. So the E. coli doesn't get a chance to connect and attach to the urothelium of the bladder wall, and therefore they cannot penetrate into the bladder, and therefore a bladder infection is prevented. So a study that was done using mannose showed that it is quite effective in management. Now again, it by itself may not do it, but it is a great adjunct for the prevention of bladder infections. And it's available over the counter. It's just a powder that gets excreted unchanged by the body. Cranberry juice is nothing but sugar. Cranberry tablets also, there are some studies that have shown to be effective. Now that's again the cost-benefit ratio. If it's not expensive and a patient is taking cranberry tablets, I have no issues with that because it has again certain agents that can potentially prevent this E. coli bladder infections. So there are some agents like this, whether it's cranberry tablets or mannose especially, which are effective in prevention of bladder infection as over-the-counter medications.